All my life, I've had an appreciation for healthcare workers, be they doctors, nurses, orderlies, EMTs, or pharmacists. I see doctors today as a display of dignity, dedication, determination, and diligence, and nurses too embody a noble, nurturing nature. Especially now as this pandemic worsens, we should be grateful for those who care for our health and happiness. Saying all this, it shouldn't surprise you to say that I am the son of a doctor. My mother is a doctor, but my sister is also a doctor, and my uncle's a doctor, and my other uncle's a doctor, and my grandfather was a doctor. I should also mention that I have a cousin who's a nurse too. So as you can tell, my family is full of medical professionals, and it may be a bit ironic for me to say, but I'm a bit squeamish when it comes to blood and organs. So while there's no future in medicine for me, I can still appreciate the work that my family does. I want to tell you of my mother and how diligent she is. From the first time I could remember, I saw my mom working on patients' notes. She would get up and leave the house around 7 a.m. and wouldn't be back until 6 at night. When she was back, she would look over those notes, call patients, and read up on the latest medical information. Even on the weekend, she'd work some. And even at night, there was a chance that she might get woken up to deal with patients while she was on call. That's not to say she didn't make time for her family. Of course she did. But she was and still is busy with work. She embodies the diligence that all doctors need to have to be good. They work to be in touch with their patients, stay up to date with the latest information, and manage the endless amount of paperwork they have. Hours are usually long, especially in the first hellish years of medical school and residency. But nonetheless, she, like her peers, persevered. She's shown me what it means to be a hard worker and put in the best effort. She's shown me how to be considerate and caring with people, especially with impatient older folks. But above all, she's shown me how to be human. She's not a doctor to make money, but to help people. To show you that it wasn't about money for her, I want to briefly mention where she went after completing her internship. She went to rural Appalachia to help the impoverished communities there. She and another doctor from the area paired up to give care to anyone and everyone in the area. She was in the middle of coal country, or what was once coal country. There, the mountains were stripped bare from decades of mining, and the air sometimes echoed with the harsh cough of a man suffering from black lung disease. It wasn't the most pleasant place to be, with few amenities or entertainment nearby, but the people there were kind, and my mother provided care. Another doctor in my family was my grandfather, who showed me diligence and kindness as well. He died at the age of 87 last summer, but up until his last week, he was working. He worked like a busy bee, never tiring. And it was hard when we lost him, but it showed me a new perspective on medical professionals. For the first time in my life, I was in a hospital. Worse yet, I was in the ICU surrounded by those in pain. And he was in pain too, yet he was surrounded by doctors treating him and nurses who gave him his treatment and made sure he was comfortable. I saw how these people could be so invested and so thoughtful while people suffered. These professionals gave it their all to help. And I also mentioned my grandfather's passing because he died of something similar to the pandemic today. He died of an uncommon type of pneumonia called PJP pneumonia, which is only seen in people with compromised immune systems. It is like the pneumonias that are currently killing thousands of people who have their own immune systems compromised by COVID-19. See, that's one of the most horrific things about this coronavirus. It usually won't kill you by itself. The virus will, however, weaken your body so badly that your immune system won't be able to fight off bacteria. This disease is scary. It spreads unbelievably fast and can go up to 2 weeks without showing symptoms. Yet I have hope. I see how our medical professionals are fighting this. They fight it head on, not shying away. Many in this country and throughout the world care for their patients with little to no personal protective equipment. They risk catching the virus, all while making sure those with it are getting the best care that they need. So while these doctors, nurses, EMTs, orderlies, pharmacists, and all other types of medical professionals work like saints, we should consider how we can best honor them and those self-sacrifice that they do. We can best do that by doing what we can to avoid catching the coronavirus. We can honor them by staying at home, only going out for groceries or medicine, washing our hands several times a day, and making sure to do it for at least 20 seconds. And by social distancing by at least 6 feet, no less, when we do go out. They don't want you to spread it. And we college students are likely to do that since we can have the virus and be contagious without ever showing symptoms. So please honor these modern day saints by following these guidelines. Our world is a better place for medical professionals. Let's not make it any worse by catching this coronavirus.